This is Dr. Jack Allergy. Please feel free to follow me on my YouTube channel at Dr. Jack Allergy, DrJackAllergy, on Twitter at hashtag Dr. Jack Allergy, spelled the same way. If you have questions, please put them down below in the comments section. Please subscribe to my channel, and if you like it, I always ask for thumbs up or likes. My previous video was on causes of urticaria, hives, welts. This video is going to focus on just two things. What studies do we need to do, and treatment. So you come to me and you've had hives for 3 weeks. Should I do any testing on you? No. Unless there is a serious mitigating circumstance, there is no indication at this point to do any testing. No skin testing. That is a waste. Your skin is already irritated. Why would I poke you with needles and something that can irritate it? It's not going to give me any information. If you want skin testing to be done for possible triggers of allergens, the key is going to be when your skin is normal and you're not having issues. So it should not be done when you're having hives. What about labs? There is no indication at the early stages. Until it is chronic, then we want to do certain labs. And I'm talking about specific labs, labs that I want to do that typically your primary care doctor or your pediatrician are not going to know what to order. And so come and see your allergist, okay? Labs should only be done usually after 6 weeks if you've had it in what we call the chronic phase. Okay? And you do fall into the chronic phase if you've had hives 3 months ago and then they come back and they're just kind of, coming and going. Okay. So, are skin testing or labs necessary? Well, skin testing almost never in any time that you're having hives, and laboratory studies are really limited and only in the chronic phase. Typically only in the chronic phase. Okay. Treatment. That's what everybody wants. I'm miserable, doc. I can't stand it. What do we do? Well, I want to know what you've taken first. Topical therapy is almost useless completely. It can be used as spot therapy to control some of the itchy spots that you're experiencing, but unless you have a bathtub full of your topical steroid cream to calm the itch down, it's useless. Plus, a lot of these general doctors are only giving you like a 30-gram tube, which will last you for like a day, okay? Topical therapy should be used as spot therapy. Oral therapy is the treatment of choice, okay? I'm talking about non-sedating, second-generation oral antihistamines. Stuff you can buy over the counter. Zyrtec, also known as cetirizine. Allegra, also known as fexofenadine. And Claritin, also known as Loratadine. Those are my 3 choices. In terms of what do I like to go with first? Zyrtec. 1 tablet by mouth, twice a day. Why? Twice? Because medications do this. And so it's on this phase that your hives start to come back. Why do we want that to happen? Let's control them now. You're obviously seeing me because you're miserable. Why are we being wimps about treatment? It's very safe. Zyrtec, 1 tablet by mouth, twice a day. It's not going to hurt you. If there's any drowsy effects, we can make adjustments. We can work with you. That's the key, but let's get it under control. Allegra, 1 tablet by mouth, twice a day. Claritin is crap, in my opinion. I'm not a fan. The true effective dose of Claritin or Loratadine is 20 milligrams. They sell it as 10 milligrams. Boo-hoo, that sucks. Why are you giving me something that's less effective and charging me full price? Costco and Sam's Club sell large quantities of these medications. Best place to buy them. Okay, what else? 85% of the receptors in your skin are H1. That's what your Zyrtec is going to block. Same with your Benadryls. But 15% are H2. That is why oftentimes I will put you on an H2 blocker, also known as an acid reducer. I'm not doing it for your stomach. Zantac, Pepcid, Tagamet. I'm not a fan of Tagamet because it interacts with so many other medications, but I will put you on Zantac twice a day as well. My Z and Z therapy, Zyrtec and Zantac. I am not telling you what to do. I'm giving you information, education, stuff that you can try that's safe. But if you're having issues, you should see the doctor. But Zantac, twice a day. I want to try to block all the receptors, all the histamine receptors in your skin from the inside out. because topical therapy is only spot therapy. Benadryl is effective, but there's two drawbacks that I can think of right away. Number one is drowsy effects. You're going to get sleepy from it. It's not good if you have work, school, family, kids, driving, whatever. You can't be drowsy. Sorry. The other drawback is it's short acting. It's only 4 to 6 hours. You have to take it multiple times. Most times people forget and they flare again and they're always chasing their tail. What about, okay, so Benadryl can be effective at bedtime. It is completely safe to take your Zyrtec, your Zantac during the day, and your Benadryl at bedtime because we get itchiest at nighttime. We're most itchy. So let's get some sleep. That's a good medicine. Sleep. What about oral steroids? People ask me about that all the time. They are a terrible choice for multiple reasons. Number one, they're cause a gazillion side effects. It's a little bit of heaven for a ton of hell. Okay? High blood pressure, worsening of diabetes and blood sugars, increased appetite, poor sleep, insomnia, irritability, anxiety, weight gain, fluid retention, cataracts. Anything else? So, when do I use oral steroids? Well, very rarely, but I will occasionally give them to people who are getting pictures, prom, weddings, whatever, big speaking engagements, as long as they're also on the Zantac and Zyrtec or any antihistamine combination that your doctor is recommending. The other drawback with the oral steroids, guess what? You take them, things go away, and then you stop them, and you get this awful flare. So, really want to try to reserve that. Antihistamines, H1 and H2 blockers are the key to controlling symptoms. You can use topical therapy as symptomatic or spot therapy. Benadryl is safe. You can also take it at nighttime. In kids, the syrups are available. Zyrtec syrup is the best and the tastiest. Allegra syrup is disgusting. Don't waste your money on it. You're going to overpay and you'll use it once and never again. Now, what's the least expensive way to go about it? Well, if the kid can chew or has teeth, you can have them chew the tablet. Now, tablets can taste gross. So what can you do? Guess what? Pick up some Tootsie Rolls. Pick up Hershey's Kisses. Pick up whatever thing that they might like. And what you do is you squish the tablet into that chewy thing and have them chew it. Simple, easy way. Still not going to be the greatest taste, but definitely better. So you can always chew the tablet. Okay. It's a lot of information to digest quickly, but antihistamine therapy is the safest and most effective therapy. There is a lot of room to maneuver. If you are experiencing symptoms that are not well controlled, please see an allergist. We are the ones best trained at controlling and finding out the cause. This is Dr. Jack Allergy. Please, if you like this video, click that little thumbs up or subscribe to my channel. If you have questions, please leave them in the comments section. I will do my best to answer them. Please feel free to follow me on Twitter at #DrJackAllergy. I hope you guys have a wonderful day.